Hello, everyone. I think people are just joining now. Wonderful to see everybody joining. I'll just allow a few more seconds just for a few people from the wait room to be admitted before we kick off. Wonderful. Well, we might get started. Good afternoon, everyone, and welcome to today's webinar, When Climate Change Hits Our Pocket, Cost of Living and Climate Change. My name is Caitlin, for those that don't know me, and I'm the Federal Assistant Secretary of the Australian Nursing and Midwifery Federation. I'd first just like to begin by acknowledging the Wurundjeri Woiwurrung people of the Kulin Nations, who are the traditional owners and custodians of the unceded lands on which I'm calling in from today. And I'd just like to pay my respects to elders past, present and emerging, and also to extend those respects to all of the lands that many of you are calling in from today. And acknowledge that sovereignty of this land was never ceded and always was, always will be Aboriginal land. Today, we have a really, really exciting webinar planned for you today. But before we begin, I'd just like to point out, for those that don't know the Australian Nursing and Midwifery Federation, I know we have many nurses, carers and midwives who have joined us today, but we are the largest union in the country, representing the interests of 356,000 members through our various state and territory branches. And we also are the largest peak body representing nurses, midwifery and care work. Today, I will begin by setting the scene a little bit and opening on our topic, which is understanding the link between fossil fuels, climate change and cost of living. We then get to hear from our exciting guest speakers, Remy and Emma. Following our presentation from both of our guest speakers, we'll have an opportunity to have a Q&A. Please familiarise yourself with the Q&A controls on your screen, because this is how you can submit questions to the panellists. We'll be doing some moderating to avoid repetition of questions. So if there's a question that somebody has submitted that you want answered, you can reiterate that question or upvote, which means and signals to us that it's a question that's particularly burning that you'd like the panel to address. Please note, you will have noticed that we are recording today's webinar. So while your camera and microphone are automatically switched off, the questions that you ask will be recorded as part of this. And any question that is entered will be recorded. Today, by the end of the webinar, you will be able to, attendees and people that have listened in after the fact will be able to recognise the impacts of climate-related cost of living pressures as they present in the experience of patients and community members, to recognise the linkages between fuel and energy supply, cost of living pressures and health outcomes in the context of a changing climate, to identify the ways extreme heat compounds cost of living and housing pressures for vulnerable members of the community. And when I say vulnerable, I mean health vulnerable, but also people that are experiencing hardship, including patients in nursing and care. And to examine opportunities for nurses, midwives and carers to advocate for systemic policy change for climate and health at local and national levels. So as mentioned, I'll set the scene a little bit, but to do that, I think it's always nice to just brush up on some key terminology when we're looking at climate change. Of course, fossil fuels is a big one that will come up today. And when we're talking about fossil fuels, what we're specifically looking at is carbon-based fuels from fossil hydrocarbon deposits, including coal, oil and natural gas. Net zero is the state where the amount of carbon dioxide equivalent that we're releasing into the atmosphere is balanced out by the same amount being removed by human actions. So things like planting trees or kelp forests over a set period of time. 1.5 degrees Celsius is a figure many of you may have heard before, but it's the degrees of warming that is an agreed threshold that we're trying to contain warming as a global average temperature, and that represents a global average temperature above pre-industrial levels, and it's a critical threshold that we're trying to contain warming to. And that is enshrined in the Paris Agreement, which is an international treaty on climate change aiming to limit global warming to well below 2 degrees Celsius above pre-industrial levels, preferably to 1.5 degrees. Why does this all matter? Well, we often hear about degrees of warming, but when it comes to climate change, the degrees of warming have real costs. The number of 1.5 degrees was decided as a threshold because exceeding this level would trigger severe irreversible climate impacts such as more extreme heat waves, droughts, floods, and significant damage to ecosystems and food security. Some of the modelling that was done by scientists in the Intergovernmental Panel on Climate Change highlighted that the impact on human health was confronting. If we exceed 1.5 degrees, the impacts grow significantly. The difference between 1.5 degrees of warming and 3 degrees of global warming is a jump from under 4 billion people being exposed to heat waves to 8 billion, and from 35 million people being exposed to crop yield change to a staggering 406 million people globally. Each of these changes would see huge cost of living impacts across the globe, including here in Australia. In September 2025, Australia released its first ever National Climate Risk Assessment. This marks a nationally significant moment, our first comprehensive attempt to understand climate risks at a whole of country scale. The assessment looks not only at how climate risks are affecting Australia right now, but also how they're projected to unfold by 2050 and 2090 under different global warming scenarios. 1.5 degrees, 2 degrees, and 3 degrees to help us to see what is at stake under different thresholds. These risks are mapped systematically across 8 national systems and they measure the risk to a particular system on a scale of low to severe. You can see from this graphic produced in the National Climate Risk Assessment that there were only 3 system impacts that won't be above a very high impact by 2050, as projected in this assessment. Economy, trade, finance, and primary industries and food, both of which have impact on cost of living, will both have very high impacts by 2050. And as you can see down in the bottom left, health and social support will see severe impacts by 2050 under current projections. Here I've synthesised the key hazards outlined in this report that are anticipated to impact on health. On the inner ring, you can see the hazards, which are floods, droughts, extremes in temperature changes, bushfires, extratropical and tropical storms, and floods. And there on the outer ring, you can see the impacts on health systems, which include things like increased pressure on health services, which many of us will have identified in our work, increases and changes in both communicable and non-communicable diseases, increases in mortality and morbidity, and heat-related risks. Our health and our household budgets depend on stable systems. Stable weather grows reliable food, stable conditions keep insurance affordable. Stable supply chains keep prices predictable. But climate change attacks that stability and quietly erodes it progressively over time. When these systems become unstable, the costs then get pushed down onto individuals and families. And it's often individuals and families who can least absorb those costs who carry the greatest burden. The Lancet Countdown has tracked this globally for nearly a decade, and the Australian report published yearly under the MGA Lancet Countdown shows the pattern at home. Things like bushfires, droughts, dust and storms are increasing in frequency and severity, and these events disrupt food and water systems while pushing demand onto our health services. From 2020 to 2024, 43% of Australia's land area experienced at least 1 month of extreme drought per year on average. And this graphic here shows how the root cause fossil fuels trigger climate disruption and then lead to unstable systems and rising household costs. These then have direct health impacts that we see. Things like we know our patients and also members of the community skip meals and have access to poorer diets. They experience heat stress and dehydration. They may be living, which we'll hear from Remy a little bit later on, in homes that are too hot or too cold to be safe. And this financial stress wraps around many existing health inequities already and worsens things like chronic conditions. We do now have the opportunity to hear a little bit more about the root cause around fossil fuels and also some of the health impacts that we see through our wonderful expert speakers who I have the pleasure of introducing. First, we'll hear from Remy. Remy Shergill is a Manager of Strategy and Engagement at the Climate and Health Alliance. Remy is an enthusiast for science communication, climate solutions, people power, and maximum efficiency. She's worked at the nexus of strategy, communications, campaigning, and organising in the climate movement for a decade, including at the Climate and Health Alliance since 2020. She holds a Master of Environment and Sustainability. Next, we'll hear from Emma. Emma Bacon is the founder and executive director of Sweltering Cities, Australia's national community voice for heat safety. Since the beginning of 2020, Sweltering Cities has connected with thousands of people around the country working directly with communities in our hottest suburbs to campaign and advocate for more livable, equitable and sustainable cities. Emma is a passionate organiser, campaigner and activist. She has worked across movements for social and environmental justice for over 14 years on campaigns, including an international asbestos ban, 10-cent deposits on bottles and cans, and union campaigns with shopping centre cleaners. She's run successful political campaigns and been part of winning significant outcomes for progressive change at local to international levels. Emma is committed to building a broad movement for climate justice. Emma lives and works in the land of the Wurundjeri Woi-wurrung people. So I now have the pleasure of handing over for us to hear from Remy Shergill.
Thanks, Caitlin. Can you guys see my screen, or is that sharing? Great. Thank you so much, Caitlin. It's so embarrassing when you hear someone read out your bio. So it's amazing to be here with Caitlin and Emma on behalf of the Climate and Health Alliance. I would like to also pay my respects to the Wurundjeri Woi-wurrung people of the Kulin Nation. I acknowledge their ongoing connection to country. This always was, always will be Aboriginal land. So I'm with the Climate and Health Alliance. We're an alliance of health and medical organisations, academic and research institutions that work together to highlight the health impacts of climate change. Great. It was great to Caitlin covered actually some of my first few slides. I've already knocked off some time from my presentation. Climate change has big impacts on our health. Here are just some of the ways that climate change impacts on our health. I'm not going to spend much time here, but we are probably familiar with the impacts of extreme weather events that we've seen, and there has been a lot of community discussion on the impact of mental health. Less obvious might be air pollution and air allergens. Climate change, the sort of complex web of how climate change works means that the burning coal, oil and gas creates harmful air pollution, which has knock-on effects for all sorts of respiratory, cardiovascular, and neurodegenerative conditions. Something that's missing here as well is the impact on culture, identity and connection to country, which is particularly acute for First Nations people. So I just want to acknowledge as well that that's a huge wellbeing impact from climate change. So Climate Science 101, what I'm saying is not going to, convince any skeptics, but this is what the science tells us in shorthand. It's getting warmer. It's us. It's because of humans. It's human activity. Yes, we're sure. Yes, it's bad, but we can fix it. There is literally tens of thousands of papers under each of these statements. So I'm not going to spend any time trying to convince anyone here today that climate change is a real issue. But what I will just give a little bit of extra info on is points 1 and 2. It's warming and it's us, because it is relevant to our cost of living crisis right now. The reason that it's getting warmer because of human activity is because we burn fossil fuels, which runs our economy, and it has for at least 250 years. When we burn fossil fuels, it releases greenhouse gas emissions. These greenhouse gases act like a blanket around the world, and it traps the sun's heat, and it leads to the large global weather and climate shifts that we're seeing. That's the science of climate change done for this presentation. What does that actually cost us? So some of the things that you might notice in your day-to-day life might be higher insurance premiums, damage to your property if you're exposed to one of those extreme weather events, higher food prices, But on the macroeconomic, so from a bird's eye view, we often refer to how climate change affects our economy and our financial well-being through extreme weather events. Extreme weather events cost us billions. Deloitte estimates $38 billion per year. Noting you're going to see different numbers in different places because it's a really hard thing to measure. It really depends on exactly what you count in each silo. But we know that it costs the Australian economy billions per year, our extreme weather events, and this is going up to 73 to 94 billion by 2060. And that depends. The discrepancy in the numbers there depends how quickly we transition and how much we can mitigate and adapt our way out of the climate impacts. But in a timely release, the Net Zero Commission report from New South Wales came out yesterday. It estimates that climate change has already cost the New South Wales economy, has reduced New South Wales economic output by 18%. And actually, the majority of the economic impact is not from climate disasters, but it's from global shifts in global weather shifts affecting supply chains. And nowhere is this more obvious than the effect of disrupting a supply chain than what is currently happening in the world's most famous strait. I'm not going to spend much time here, but we all know that this is the fuel crisis that is largely responsible for a lot of the cost of living pressure that we're feeling now. Our health sector is highly dependent on fuel. So out of the Middle East, we get diesel, gas and petrol, and large swaths of the health sector are still dependent on these fossil fuels for their backup power, which is mandatory for all hospitals. We use gas extensively to power heating and hot water sterilisation services. Many of our fleets are not electrified. And also our workforce primarily gets to work through petrol-powered vehicles. Most Australians use cars to get to work. So, and this is just some of the ways that our health sector is dependent on fuels. So when this crisis kicked off, CAHA really wanted to understand what was the impact of this crisis on healthcare workers. We asked our audiences. Now, I just want to flag, we had 78 respondents, which was great, and we got some excellent stories. I'm not by any means claiming that 75% of all healthcare workers necessarily feel this way. We don't have a big enough sample size to say that. But what I can say is that we asked, of the people that we asked, 50% of them said that they've already noticed an impact from the fuel crisis on their workplace. 28% said not yet, but I'm expecting it will. And noting that some of these responses came through as early as April. So some of those impacts will be coming through now. And a quarter of people said no, they haven't noticed any impacts. So how is it impacting our workforces? So some of the responses that we got from our survey, many people referenced interrupted supply chains, particularly concerning for medicine and jet fuel, increased workplace costs, increased personal costs. So stories of staff no longer being allowed to use the fleet and instead being asked to use their own vehicles. And effects on well-being. So many people reporting that they were feeling anxious, not just about cost of living, just about the global crisis that we find ourselves in at this time. And increased work from home, which for some people might have a good impact on their well-being, but for some people leads to them feeling more isolated and less enjoying aspects of their work less. So I'm just going to share some stories share some of the responses from healthcare workers across Australia that goes to show how our dependence on fossil fuels and importing fossil fuels is impacting the workforce. So first, all four of these quotes come from people working in regional Australia. The first one, travel between service sites has become more expensive to the point where I resigned my job. That's obviously a really extreme thing to have to do, but the expense claims were not keeping up where this person could see that this was a worthwhile thing to do. Second one, this person is choosing shifts closer to home to avoid long commutes. And the third one, many of our nurses travel up to 2 hours, and I expect we'll leave our regional facility soon. What these stories show is how when our fuel prices increase, the health services that are hit first are our regional health services, which are already likely under pressure from workforce shortages and increased prices of having things reach their facility, having supplies reach their facility. These are also the regions where diesel and petrol are most needed to keep the health service working, and where we know that often people in regional areas may have less access to work and less access to healthcare anyway. So the pressure being put on the health service from losing staff members is just another problem that regional health services really don't need to deal with right now. We know that some health workers who maybe aren't themselves based in remote areas but have the requirement to travel to remote areas to deliver care, that sort of service is happening less often. I spoke with a Melbourne pharmacist in a community health service. People are showing up to appointments less. We saw this during COVID as well, but we are seeing a lot of missed appointments, and this is going to lead to a lack of adherence to health plans or medication requirements. And interestingly, I spoke to an air retrieval service worker. I couldn't say exactly what service they worked for privacy reasons, but they're really concerned that jet fuel is going to become in short supply, and that's going to affect the ability of their service to go around and pick up people in remote areas that need to get to hospital. So the way that the fuel crisis permeates throughout the health sector is complicated, complex, and it's ubiquitous, of course, as it is with the rest of our economy. The starkest difference appears between cities and our regions. So again, this is a structural disadvantage for our regional health services, and it's going to have long-term health impacts on Australians. For instance, reduced access to healthcare and missed appointments. We know this has a long-term effect on health, both physical and mental, in a myriad of ways. As the cost of fuel, we know it's gone down a little bit due to some settling in the market and some government initiatives, but we're not at the end of this crisis, and we don't know exactly what's going to be happening with the fuel supply. This is going to increase the cost to the health budget, absolutely. As health workers choose to step away from work where they don't see it as worth it to commute, that is also going to result in poorer service delivery for some of our patients, and increased psychological distress from reduced employment. I spoke primarily to health workers who were delivering the services, but this is some work from the ABC. Bruce has kidney failure. He travels from his remote town in South Australia to a larger town, a couple hours away, 3 times a week for dialysis. And he said he's really concerned his family have cut down their budget to almost survival rations so that they can afford fuel. This was when fuel was reaching about $3 a litre in regional areas. which has come down a bit, but we're also, this isn't a short crisis. We don't know when it's going to end. So the pressure is building for people. The good thing that we got out of our survey is that the workforce actually has already invested in resilience. We heard from health services that have already electrified their fleets. Many staff are carpooling or embracing flexible working arrangements. And you know, this is an area where the health sector is leading. We are doing our bit to electrify, but we need a lot more support from governments to have the resources to get this done. I think it's clear that it is time, in order to have a resilient health sector, the health sector has to reduce its dependence on fossil fuels. It's really complicated, obviously, in this moment to accelerate the shift to electrification, but we absolutely cannot be propping up an industry which is putting our health sector at this much risk. And in the meantime, incentivizing public transport and active transport where possible is only a good thing for our health and for our economy. I'll pass to Emma. Sorry, I went over time.
That's more than fine, Remy. And before we throw it to Emma, I just want to say there were so many threads throughout your presentation there that I think we can really relate to. Many of us can relate to in what you've shared. I do love the addition of the hot off the press analysis from the New South Wales Net Zero Commission, and we have a number of New South Wales members, so I'm sure they would have really appreciated that very, very hot off the press analysis. But also some of the remarks that you heard from the CAHA survey, we've also been hearing from our members across the Australian Nursing and Midwifery Federation and our various branches, just around the impacts on care service delivery, but also in ability for patients to access medical appointments, and also for you know, nurses, midwives and carers to actually turn up to work. So some really pointed things there, and I'm really excited to unpack that a little bit further in the panel. But before we do now get the pleasure of hearing from Emma, who's going to talk to us a little bit more about some of the things that Sweltering Cities have been seeing in some of their work and some of the things that they've been leading. Thanks, Emma.
Thanks so much for having me. I'm also starting a little timer for myself because I love a chat. Thanks, everyone. It's lovely to be here. I'm going to share my screen. I've also got a presentation. I'll just bring it up. So, as Caitlin mentioned, Sweltering Cities is the national community voice for heat safety. That means we work with people in hot homes, hot suburbs, hot workplaces, hot schools, hot towns across the country on campaigns and advocacy for the solutions that really address the root causes of heat risk in our communities and everywhere else. We did start off in 2020 as very urban focused, but more and more now we're sort of trying to meet the demand from people in rural and regional areas who also want to talk about the different heat impacts on them. I'm joining, as mentioned, from the beautiful lands of Wurundjeri Woi-wurrung people today, and also want to acknowledge the care and custodianship of elders past and present, as always was and always will be Aboriginal land. Just quickly on heat waves, because heat is a little bit more, I guess, complex or multifaceted, maybe, let's say, than just you know, one cause. So I'm going to talk briefly about like 3 different ways we sort of understand the impact and, you know, the impact of heat. So firstly, we've got those acute instances of heat waves. These are periods defined by the Bureau of Meteorology as 3 days of, at least 3 days of like high minimum and maximum temperatures. You've got a diagram here of, you know, showing those periods of time, but I'm sure all of us are really familiar with what it feels like. I know in January this year in Melbourne, in Victoria, we had some of our hottest, actually the hottest ever temperature in Victoria, but we've had all over the country really significant extreme heat waves over the last few years, and lots of temperature records being broken. We also, as been mentioned a couple of times, are right now experiencing global warming due to climate change. So this is a graph showing, you know, average yearly temperature here in Australia, where you can see that, you know, this isn't just about those acute instances of heat over a few days. This is also like on average warmer years, which means that it's not just a hot summer, but also experiencing hotter winters, hotter springs, hotter autumns, and longer stretches of heat. Our summers are much longer than they used to be. But on top of that, we've also got the urban heat island effect that really heats up our any sort of urban environment, including towns. And so what urban heat islands are is they're areas where there's not very many trees, there's lots of concrete and dark surfaces that absorb and then radiate back out heat, attract heat, and they can be 10 or even 15 degrees hotter than surrounding areas. This is a map of the urban heat island across Sydney, some of which areas are so big they're now called urban heat continents. But it's not just those big areas of, say, Western Sydney where you have, you know, lots of treeless suburbs designed for cars. You know, we know that that area can get extremely hot. But also heat vulnerability and the urban heat island effect can happen even in places that we might think of as a bit cooler. So this is a heat vulnerability index from the inner city of Sydney, where you can see some of the highest areas of heat vulnerability are places which are ex-industrial, which are, you know, are now being turned into apartments, places where there's lots of public housing, not very many trees. And so just because you don't live in, you know, what might be considered a hot suburb doesn't mean you don't live in a hot home and might be at risk in the heat. Even at a very micro scale, I think what we understand on this really, you know, you might be having a very hot summer with extraordinarily high temperatures. It might be a heat wave, and then you are sitting, you know, at a bench like this, maybe waiting for a bus with no shelter, no shade, getting extremely hot. So we also have those micro experiences, and I always explain it as the difference between, you know, being on a hot shopping centre car park on a summer's day versus being under in a park with a nice tree. So those are sort of the different ways that heat sort of compounds. We've got the urban heat island effects, we've got these longer, hotter summers, hotter years, and we've got the extreme heat waves. And so what Sweltering Cities is doing is trying to change the story of how we think about heat in this country. One of the main things we're trying to do is to shift the story when it comes to the media. So you can see here on the left, here's a couple of pictures from earlier this year when it got really hot. And the first thing that photographers will do, even if it's like this is record heat, is go to the nearest places where people are taking off their clothes, the beach, the pool, things like that, and say, oh, here's what people are doing. But that's actually not the, you know, common experience of what lots of people are experiencing at work in their homes. Heat waves are actually the deadliest environmental disaster in Australia. They kill more people than all other environmental disasters combined. But the number of deaths is not the whole story. You know, you also have significant mental health impacts. You've got lots of other physical health impacts, maternal health impacts. There are social impacts such as an increase of violence, including domestic violence on hot days. And so that vision of, you know, someone running along in a bikini is just not accurately reflecting the scale of disaster or impacts that we know are happening. And so one of the things Sweltering Cities is trying to do is put the voices of people with lived experience into the media. You'll see here a picture of Phoebe. Phoebe's on compulsory activities related to her disability support payment, where she has to go to appointments, trainings, things like that, lives in Perth. In Perth, they had 7 days in a row. They beat the record of the capital cities with the longest number of days over 40 degrees. In the middle of that, Phoebe had to go to a compulsory appointment. Otherwise, she was worried about losing her payment. We're trying to get the federal government to stop cutting off people's Centrelink payments during the heat, so they're not doubting whether they can follow the health advice. So we put the voices of people like Phoebe in the media, sort of demonstrate why that's so important. We also do community organising. So this is about building power, building connections, building networks in lots of hot suburbs. Here's a couple of pictures from our Footscray and Sunshine Cool Walks, where we take people around for a bit of a walk, a bit of a roll or a stroll, to talk about what makes our local areas cool or hot. It's a way of looking at the impact of climate change at a really hyper-local level, because sometimes it feels like it's really hard to conceive of what global warming might look like, but we know what it's like for our parks to be really hot in summer and what needs to be done about it. One of the last thing we do are 3 sort of big pillars. We've got storytelling, organizing, and then campaigning. And some of the big bits of work we've been doing around housing. So in Victoria, we helped win cooling and insulation in the rental minimum standards, and we're now working on that in New South Wales alongside some other amazing organisations. The photo here of the alfoil is actually a photo sent to us by a nurse who was doing night shift, and then during the day she had this west-facing window in her apartment in inner city Melbourne. And she said her and her partner just absolutely couldn't sleep. Their apartment was so hot. They were asking their landlord for better blinds, and he said, "Well, I don't need to do it." And so she was struggling to get to work, having not slept enough. This was in about 2021, so she was doing obviously some really hard work related to COVID and the stress of that, and still didn't have a safe home. So she's one of the people that was involved in helping win those different provisions in Victoria, and actually acknowledging that our rental laws need to keep up with climate change. And finally, one of the other campaigns that we've been working on is better bus shelters in Western Sydney. We've also recently had a great result on that. Basically, we worked with thousands of people across the city, or hundreds of people across the city, to map thousands of bus stops. This was what people nominated and voted for: the worst bus stop in Sydney, with snakes in the grass, cars, no shelter, no shade. And we worked on collectivizing the problem to understand that it's not just about one stop, it's not just about your street, it's actually about a provision of public infrastructure that makes our bus system safe, accessible, climate resilient, heat resilient, and also helps us decarbonize our transport system, as public transport is the safest thing to do. All of our work is really based on thousands and thousands of conversations basically that we have with people across the country from all walks of life, all locations. Every 2 years we do a big summer survey, and we've released our last one a couple of months ago. So we've got over 2,600 responses around the country from 766 unique postcodes, big chunk in New South Wales, but also significant samples from across the country, including a real strong representation from the ACT. Good on them. We found that about 2/3 of people reported feeling unwell in the heat. Often, if I'm doing a presentation about this, I ask people in the room to put up their hand if they've ever struggled to sleep on a hot night and how that made them, maybe feel groggy, dizzy, disorientated, tired the next day. I hope that you'll all, pretend that we can do that in this room. And this is to demonstrate that this isn't a problem of a small group of people, that like the impact of heat, on our health is, everyone's problem. But we also asked people what other factors might help make them more at risk in the heat, and found these really troubling statistics around saying like 87% of people with disability are reporting that they feel unwell in the heat. Unfortunately, here in Australia, according to epidemiological studies, 89% of people who die in the heat are people with disability. And that, just to pause for a sec, is just a really shocking statistic, to say that almost 90% of people who are dying in the heat are people with disability. We need to be doing a lot more really targeted support for people to make sure that they, are not isolated, they have the supports they need, and they're not, struggling to afford to keep cool. We also found that renters, people with multicultural backgrounds, people who work outside, and people living in low energy efficiency homes were all more likely to say they felt unwell. We did a deep dive on cost of living. So really the main story from the summer was people cannot afford to keep cool, and it is making them sick. So over 60% of people reported the cost of living pressures making it harder for them or their family to be cool, to be safe. During a heat wave over the summer. But again, a higher proportion of people live in low energy efficiency homes, a high proportion of renters, and an even higher portion of people living with chronic illness or disability. And so, there you see those intersections of, what we talk about as Sweltering Cities. The work we do is through the lens of, climate change, inequality, and health. And this is where that is like acutely felt. So it's people who are live with a disability are also struggling with cost of living, and they're feeling those health impacts. Oh. We also asked people for the first time how much they worry about the cost of energy, and found that renters are much more likely. So 1 in 3 renters are saying that they're worried about the cost of energy daily. That's also, of course, placing like an enormous mental burden on people. And we know that, for example, I said earlier, domestic violence goes up in the heat. It's that financial stress, as well as feeling hot and uncomfortable, that people, anecdotally, people in services say is one of the main reasons why that's happening. So it's people, again, feeling anxious that they cannot afford to keep cool, they cannot afford to keep their family safe. We asked people specifically, we're trying to do a bit more work at the moment in understanding how people are affected by heat at work. So we found a bit over 40% of people said the heat does affect them at work or school. And we found that the majority of people are saying either, when we're asking like, could your workplace do more? We're finding that the majority of people are saying either they don't do anything, I'm not sure what they are doing, or they could do more. So there's a significant opportunity here. Something that we're sort of doing a more deep dive work on at the moment is the impact of heat on people who work in care, community services, and social services. So we hear from people who are disability support workers, work in aged care or home care nurses, that they're going into people's hot homes who might not be able to afford to have air conditioning, turn air conditioning. It might be an extremely hot environment where they're doing physical work. Hearing about someone who was a home care nurse who said that over the summer, it was so hot in this person's house that after they'd helped them shower, they both just lay down on the floor of the bathroom on the tile floor because that felt like the safest, coolest place for them to be. And so this is a type of work conditions people are in, but they also might be coming to work tired and exhausted and also impacted by heat themselves. We might think traditionally, not traditionally, but sort of more conventionally, that people who are most affected by heat at work are people who work in construction or agriculture or things like that. But actually, we know that people who are essential workers in the heat are people who are doing that care, that outreach, and also people who are, most affected are often most likely to be in insecure work. So they're worrying about whether they even have the choice to not go to work, even if they know it's dangerously hot. We asked people what they do during the heat or might they change activities. So of course, the majority of people, almost all people are saying they change when they do outdoor activities, including things like walking, avoiding catching public transport, things like that. About 1 in 3 people say they leave the house to go somewhere cooler, which is really significant. We see that as a push factor. People are not feeling comfortable at home, so they go to friends' houses, to parks, to the beach, to shopping centres, to libraries, things like that. We measured again comparing people, all respondents, people with disabilities, and finding that people with disabilities are significantly more impacted by things like avoiding catching public transport, avoiding walking a little bit more as well, which might compound the impact of isolation. And we know isolation is really deadly in the heat or in any disaster, but it means that people might not be going to appointments, having those social relationships, things like that. And finally, we asked what kind of policy interventions people want to see from the government. This is not a poll around Australia. These are thousands of people who Sweltering Cities contacted. But we still think this is a pretty good sample size to understand what people want. And so we see really strong support for heat safety standards for rentals, making our transport system safe in the heat, things like building homes that are safer, and changing the way we plan our cities for cooler suburbs. We also saw still significantly more than 4 in 5 people supporting retrofitting, not approving coal and gas mines, which are heating up the planet. And almost 3 in 4 people saying they don't want to see income support payments cut off because people haven't feel uncomfortable leaving the house. So lots of strong support for these. You'll notice that none of these are about what the health system should do, because actually the health system is the most aware of heat as a problem. These are all ways for us to reduce risk on people in their homes, at work, as they're going around their days, to make sure that it's less likely that people end up in the health system because they're not being exposed to that dangerous heat. Finally, the last thing I wanted to show was a tool that we helped some people at Sydney Uni develop, which is the Heatwatch web app. So if you go to that QR code, you can have a look and have a play around. It might be something that's interesting for people as it gets warmer in summer. We often use Darwin as an example in winter because it's still warm. But what this is it's an attempt to actually combine what we know about how heat, humidity, UV, accumulated heat over many days affects the body, beyond just saying, here's what the temperature is. And so this is a tool people can use to both understand heat risk, where they are, they can personalize it with what medications they're on, how old they are, things like that, and also give some really clear advice. So I wanted to show this as an example of how we are trying to combine more information we know about climate change, trying to create new tools, new technology to support people, but also saying we cannot let this become an individual responsibility, an individual burden on people to manage. We have to make sure we're having those systemic interventions that mean people have safe homes, people have safe workplaces. We're putting lots more money into our health system, our care system, our community services to support people directly. We need accessible transport systems, things like that. And that, this sort of advice that I'm showing you here, the Heat Watch app, should not just be for workers or individuals. It should also be how we understand the risk that organizations, businesses have to manage as well, and how we can keep each other safe in the heat. So that's my presentation. So yeah, thanks very much. That's a bit about work. I'll put, people can look up our website, swelteringcities.org, to read more about us.
Absolutely wonderful to hear from you, Emma. And I'm always so blown away, I think probably from Remy as well. Obviously, I'm a registered nurse and a health professional myself, but Remy and Emma are from different backgrounds, but you would not be able to tell with how much of how strong the allyship is with the health community and the work that they do in the climate space. And I'm always learning new things from both Remy and Emma. We now get a bit of a chance to ask some questions of our panelists, and just a reminder for people that have questions that they'd like to ask, please pop them in the chat. We already have a few that are coming through, so please feel free to upvote the ones that you want to hear. One thing that I was thinking about as I was listening to you talk, Emma, was around community voice and what we're hearing from people in the community about their experiences of heat. And I've heard you speak about various different experiences, and we even got to hear from some examples today, like the nurse that was putting alfoil on her windows. I don't think that image will ever leave me. But obviously from what you've shared, you've been mapping this through survey data for a while from Sweltering Cities, and I just wonder if you'd like to speak to how is the narrative shifting over time? Do you feel like there's much of a media shift in how we're talking about heat, particularly because it's such a an insidious sort of risk to health? And what sort of things have you been hearing from the community around heat and cost of living? Some of that might have been reflected in your survey.
Sure thing. On the media briefly, I think there has been a really significant shift over the time that Sweltering Cities has existed, which is really good, partly due to us, partly due to rising temperatures, partly due to the great work of other people. But the problem is that journalists still only really understand the problem when they themselves are hot. And so it's really hard to get them to plan over the pre-summer. And we're like, we promise it's going to be hot. They're like, we'll wait and see. And we're like, we promise it's going to be hot. And so I think it's that work ahead of time. We still need to shift the news planning, even if we've had a bit more luck shifting the news attention, if that makes sense. They just don't plan for heat waves in the same way they plan for fires and floods, for example. On the stories, I think that the story that for me really, I think, defines how, or has really influenced the way I think about a lot of this, is a story from Western Australia, with someone who told us that over the last summers, it has been record heat, really hot in WA. And what they were finding is that just day to day, they had to keep their aircon on an hour or two longer. And that impact on their electricity bill over time meant that, they were putting less fuel in their car, and that when they're at the grocery store, when they're at the supermarket, they're standing there looking at things and wondering how much fresh fruit and veg they can afford and what their next bill is going to be. And I think, we know that, again, isolation I've mentioned a couple of times, but also diet, not turning on the aircon, all these things can have health impacts on people. But it is that compounding problem of it is the fuel crisis that Remy talked about. It is, the cost of fresh fruit and veg, it is the cost of transport, cost of energy, that's just leading to this huge sense of anxiety people have that they can't, that then they're not in a position to make choices to protect themselves because they just can't afford it. And that's just really hard to know that in a country like ours, this is not an uncommon experience. And that actually climate change is not a problem of the future. It's a problem, and it's not a problem just for kids, right, in the future. This is something that we need to worry about our parents, our grandparents, ourselves, managing this right now. So I've heard, hundreds of thousands of really powerful, sad, impactful stories, but I've heard just as many ideas from people about what they want to see and the changes they want to see and how they want to get involved in what we do. So I think I've still got great optimism that the community power and the collectivization of this issue, so that we're bringing it out of people's homes, out of the privacy, like out of, that anxiety, to say like, well, you're not alone if you can't afford to pay your air conditioning bill. You're not alone if you struggle with your cost of living. Actually, it's something that's really common. And if we collectivize the problem, we know we can see that the solution has to be urgent, ambitious, transformative. And it is that collective power that both, that's what the union stands for, but I think that's also the spirit we have to take to so much of our work.
I really love that, collectivizing the problem. I really agree with that sentiment. I think it's a really great way of framing that problem. A question that we've had in the chat, and I guess this is an extension of what we're just, talking about there, was around, communicating with patients. And Remy, you've got quite a bit of experience in, developing toolkits for communications for health professionals. And I was wondering, just sort of building on what we were talking a little bit earlier around, collective consciousness, ownership of the problem, connecting cost of living to climate change. Do you think that's happening? And what role do you see nurses, midwives and carers taking, and how can we communicate with patients and the community about these interlinkages?
It's such a good question. The first thing I say to health professionals nurses, midwives, when they want to talk to their patients about climate change, is just to emphasize, like, this is your job. This is your lane. A lot of people feel like, I care about this, but I don't see that I have the relevant experience to be talking about this. Actually, many health professionals have seen the impacts of this in their work, and it's completely justified for them to talk about it. And it's a way of keeping your patients safe and giving them the information that they need to keep themselves safe. The advice I would give is to stay in your area of expertise. Talk about the health impacts. That's where you're going to be the most powerful communicator. And don't be afraid to bring it up in moments where, it's acute. During extreme heat, it can be powerful to let people know, this isn't a one-off. Unfortunately, this is something that is likely to get worse, and we need to think of long-term strategies for your health to handle, the impacts. Sorry, Caitlin, there was a first part of the question.
Was just around, do you think people are connecting these issues together? Like, do you think that the community is connecting cost of living and with climate change, and that there's changes over time in relation to that?
So the good news is, not that extreme weather events are ever good news, but many, many more Australians have been affected by climate events, whether it's extreme heat waves or floods or bushfires. And it may not be them directly, but it may be someone they know. They may have been affected by bushfire smoke during 2019, 2020. The consciousness of Australians has absolutely increased when it comes to how climate change is affecting them. And the people that there is, of course, I get a lot of concern, hey, am I going to run into a denier if I bring this up? Chances are no, there's actually not that many of them. And if you do run into them, don't even engage. It's not worth your time. But the majority of people who maybe are less engaged in this issue is not necessarily people that you might expect. It might be, parents of young kids who are really, really busy. Sharing a story with them about your personal experience as a health professional, or if you're not a health professional, but say you're a renter who lives in a really hot house, rather than talking about the science of climate change, share a personal story or a story about your professional life, about the impacts that you're actually seeing, and just leave it with that person, and that person can take it on and percolate. We never want to preach. It's not helpful. But this is a topic that many Australians are open to hearing about. So whenever an organisation or a health professional takes it on themselves to share that story, it gives climate change that extra legitimacy that it needs. Like, we need a cultural shift to have everyone talking about this, because it's an issue that permeates pretty much every aspect of our life.
Agreed.
Can I
Yes,
just add
Emma?
in on
Yeah,
that,
absolutely.
Tracy? So, because like I do talk to people who don't sort of believe in man-made climate change. Like, I do, like, as part of this work, because we work in places where people are experiencing heat and they don't necessarily, like, they've got lots of different opinions. And I find that exactly what Remy's saying, like the sharing of the personal experience and then the curiosity about other people's experiences, is just an incredible way to build that connection and to say, like, how have you been, like, what do you think the weather's like? How do you feel like the weather's been the last few years? Like, what do you think we need to do? Like, what was it like if you experienced the heat, the fire, or the floods? Like, for me, I used to live in Sydney, and I think a lot of people experience that 2019, 2020 summer of all the smoke as a really, like, scary moment. And I think, like, you don't need to be, trying to feel like you can convince someone, to just ask them with curiosity, like, how did you find that summer? And that conversation, I think, is just, it's so visceral what we feel about, like, our health and our family and what we care about. And so coming to it with curiosity is exactly what we do. And I think exactly how we can have really, conversations that build relationships that don't always need to hit a wall, So that's my small thing on this.
And a great addition there, because I think that's something that, as nurses, carers, and midwives, that we do, and it's something that is in our wheelhouse. And I think Remy spoke to, finding our area of expertise and what we can offer. And I think being able to have conversations that are real, and hear where people are experiencing these impacts is definitely a very big strength that we bring to this conversation. Now, I am mindful of time, and I think I could keep this conversation going for many hours. But in the interest of keeping to time, I would love to ask just one last question, which sort of groups two questions together from Emma and Sarah, just in relation to, immediate sort of steps that we take, how we balance the immediate financial strain people are facing with the urgent need to invest in long-term climate resilience, and nurses, midwives, and carers, how can start documenting or reporting to make impacts visible. I will just give if I can get just a tight sort of 1 to 2 points from each of you before I do a bit of a wrap up. I'd love to hear what your thoughts are in relation to those 2 points there. Maybe I'll call to you, Emma, first.
I think, on that short-term investment and, like, the measurement and things like this, I'm so frustrated every time we're approached with more researchers who are like, oh, we're going to map heat vulnerability. And I'm like, mates, I could draw you a map. Like, I can tell you who's hot. Don't even worry about it. Like, I think we need to be really heavily investing in the solutions that we know are common sense, supported. All the investment, like, it is expensive. It's extremely expensive what we need to do. The cheapest and easiest time to do it is now. And so, like, all the investment in resilience, in preparing our workforces and in preparing our infrastructure, is better done now in the future. And that is just, like, I think that's the number one thing we say to people is, like, let's build houses that are safe for the future. We have the data on that. Let's prepare for the workforces we need. We have the data on that. There's so much investment that has so many co-benefits to our communities, whether it is green streets or, good jobs or safe homes. All of these things are climate adaptation and climate action, but they are also what it takes to have a really healthy society. So, that's what I would say.
Fantastic. And Remy, from you?
I would, emphasize in the spirit of unionism, we are much more powerful when we work together. There are several, including the Climate and Health Alliance, there are organizations that are doing some of this work. If your organization wants to contribute at a systemic level, I really recommend getting in touch with organizations like the ANMF, like CAHA, and feeding into the work that is already happening. And on a big level, Australia absolutely needs, at this moment, talking about this being the cheapest time to do it, we have an opportunity to accelerate the shift to electrification in our hospitals, to give us you know, the long-term security to stop this sort of thing from happening again. None of this is easy or it would have been done, but we absolutely should not be subsidising fossil fuels in this country. And initiatives that make getting around on public transport cheaper for people right now is only a good thing.
Right. And that actually just, I think your points about, you know, collectivism just segues beautifully into some of the work that we're doing with the Australian Nursing Midwifery Federation. As I mentioned, we work really closely with our branches in some of the work that we've been doing, which is fantastic. And I will bring them up again because I work really closely with branches through the Climate and Health Unit, and some of that group works together to inform some of our advocacy positions. So we lead some work around housing, but also on working with external stakeholders on advocating for reforms on things like fossil fuel subsidies, which we highlighted. It was a major driver of continued reliance on fossil fuels. We also are doing work on adaptation and resilience, advocating for greater investment in the health system to respond to climate change. And that we're doing through the Climate Safety Plan. And I've had the pleasure of working with Sweltering Cities and the Climate and Health Alliance with Renew Australia for All, which is a coalition of 80 different organisations. We don't have time to go much more into depth about that, but I guess the take home that I'd like to leave with members, after thanking our wonderful panel for joining us, thank you both Emma and Remy, is that there's always opportunities to share your story as part of this movement. In driving advocacy, I think storytelling is a really key way that we can be a part of creating change as nurses, midwives and carers. So please do get in touch with us if you're interested in some of the advocacy work that we're leading, because we're always really excited to hear from you. Once again, thank you to our panel, and thank you to you all for joining and listening so well, and for participating and engaging in questions. I'll leave you with this message of hope that we will create change, and that it's conversations like this that creates the opportunity to do that. Thank you, everybody.
Thanks, Caitlin.
Thanks, everyone.